topic of breathing when it comes to anxiety is one that often we hear from therapists. They've heard a lot of different information from different kinds of training sources over time about what to do about breathing. So how do you like to explain what you say about breathing?
Yeah, I mean, I actually just like to have a practice with people. You can see I do that a lot. I just like to have an experience. So, you know, when I'm working with a client or when I'm training clinicians, I just say to them, if I just said to you, oh, you're looking really stressed out, like before we start our session, let's just go ahead and take a deep breath. What would you do? Let's all together to go ahead and just take a deep breath. Automatically you'd go, okay, so what we both just did was we took in a lot of oxygen.
Right.
And then we did a quick exhale, and we also took that air in up to here, right? We had our shoulders moving, right? And so what's really important for all of you to know is that's the opposite. Remember, we do everything that's paradoxical. It's the opposite of what's helpful. Our amygdala is always paying attention to how much oxygen and carbon dioxide we have, and when we bring in more oxygen, that actually activates the sympathetic nervous system, and it makes our brain feel like, oh, we're oxygenating our muscles, we must be in danger, we're getting ready to fight or flight. And so it's really important that we teach our clients to breathe with a longer exhale, that we actually increase carbon dioxide, and that activates the parasympathetic.
Increase the oxygen.
Yeah. So let's do a couple of those breaths, and then maybe you could talk about, like, so when do we actually have our clients use this breathing? Okay?
Right, exactly.
So if I'm working with children, I talk to them about smelling the roses and blowing out the candles. And I have 56 candles, so we laugh and I say that's a lot of candles to blow out. But so you take a regular inhale and a longer exhale. Is there any particular analogy or image that you give people with that?
I talk about blowing out the candles, but I actually have people hold up their finger because that way they can feel.
Yeah.
You feel the air going past, and I think there's something really nice about getting that feedback.
Yeah. So let's just all take 3 breaths together. What we're going to do is we're going to take a regular inhale and a longer exhale. You can blow on your finger. You can imagine smelling the roses and blowing out the candles, however you want to do it. But what's important is that you breathe through your diaphragm and that your belly is actually going up and it's coming back down as you exhale. All right, so let's do that together.
Yep.
I'm going to use my hands so that you can kind of see. Oddly enough, we're going to start with an exhale. That's even more doing the opposite, okay?
Right.
Okay. And hopefully if you all were breathing with us, you just noticed that there was a very calming effect of that.
Yes.
And I think many of you who have learned to breathe, maybe you do yoga, maybe you've done some trauma training, and you kind of rely on breathing for a lot of your work with your anxious clients. So I think maybe we need to talk to them about when it's appropriate
to do
not.
Yeah, so we love to do calm breathing. It's such a wonderful part of a good, rich life to be able to practice quietness, to be able to calm our body and our mind. But it's not something that we do when our clients are having panic and anxiety. And I know that that can seem very counterintuitive, but again, it's part of the whole paradoxical nature of the way that we treat anxiety. Because we want our clients to experience anxiety because we want them to learn that they can tolerate anxiety, that it isn't a catastrophe, that it's a yucky feeling, but if you do nothing about it, it will pass on its own. And I think that if you do breathing exercises during the time that you're doing the practice, the evidence actually shows, the research really shows that people don't do as well in the long term because they're still so frightened of the experience of anxiety. So really what we want is we want our clients to get very comfortable with being uncomfortable.
Yeah.
That's a big part of the treatment.
Yeah, and I would say too that, and I imagine most of you have had this experience, which is if you ask them to breathe with, 3 breaths with longer exhales in the middle of a panic attack, and you come back and you're like, well, how did that go? And they're going to say to you, it didn't work.
Right.
It didn't work because they have the chemical dump. The chemical dump has happened, okay? And so breathing isn't going to take away those chemicals. So just like Elizabeth said, we're working on increasing our clients' ability to handle distressing thoughts and feelings. And it's really important that they develop that skill and that they're not using anything to avoid or get away from those feelings. And we were just in a workshop together and they were talking about that there's all these different contents to people's anxiety, right? Maybe they're afraid that they have cancer, or maybe they have intrusive thoughts with OCD, or maybe they're afraid of leaving their mom to go to kindergarten or something like that. But ultimately what people are afraid of is their inability to handle that bad feeling. They're afraid that bad feeling will never go away and they won't be able to tolerate it. So all of our anxiety work is helping our clients handle the bad feelings. So I'm not sure if we've spoken to, so when do you practice the breathing with clients? Or when do you ask them to do it?
I ask them to do it at a regular time or set aside time to take time and help themselves have quiet or meditation or mindfulness. What about you?
Yeah. For me, I want clients to do it, on a daily basis. Maybe every time they're in the car, or maybe before they get out of bed. And the purpose of it is for them, to have just these spaces to tolerate whatever they're experiencing, and that also gives them a little bit of practice, right? So maybe they're feeling a little bit stressed about going to work, and they're just sitting there doing their breathing. What I want them to have is just a way to create space with their breath to tolerate whatever their experience is. But I want them to do it in a consistent way every day, rather than in response to their anxiety at a heightened level. I hope all of you can understand that.
Right. And we really wish we could answer your questions right now, because I feel like in my mind, I see a whole bunch of hands going up in our audience who have questions about all of this. Please stay on with this. We have other videos that we've talked about some of these concepts, and we're going to talk about more in future videos. But this is really an important concept. This concept of what we talked about earlier, willingness, so you can come back and look at our video about that. But the concept of needing our clients to learn that they can tolerate those difficult feelings of anxiety. So we are not just teaching them to deal with any particular fear or phobia or OCD symptom that they have. We're teaching them to look at this as a whole so that they're prepared in their life to be able to go out. And I think one of the things that really does is it helps with what some therapists will talk about, which is clients can seem like they kind of have a whack-a-mole situation where they have new anxiety symptoms that pop up just as fast as they deal with the old ones. And this is really one way that's a very important way to stop having that happen.
Yeah, because it doesn't matter how it shows up. If your clients are skilled up with, oh, that's just another distressing experience, and I know I can handle that, and how can I practice an opposite response, then it doesn't matter how it shows up.
Now you know the answer.